The deterioration of our healthcare system has been well documented, but the mental health struggles and psychological trauma experienced by the workers haven't had much attention. Tonight, CTV's Penny Daflos gives us insight into the impacts and pleas for more help.
It wasn't so long ago that British Columbians were cheering on our healthcare heroes. But as the pandemic grinds on and toxic drugs continue to claim lives, many frontline workers are faltering.
Having seen so much death and crises after crises, they just are at that breaking point.
We see human suffering at levels that most people don't see ever in their lifetime.
The normal stressors of the job are compounded by working short-staffed and unable to do their jobs properly, on top of losing even more colleagues to long-term disability in the wake of traumatic events like the 2021 heat dome and waves of COVID.
To have to go from one death to the other and not having the time to process that. Nurses only have $900 in benefits towards psychological help, and so that's only going to get you a few sessions.
The most recent available WorkSafe BC data for mental disorders is topped by nurses and paramedics with the most approved claims.
The idea that we knew what we were getting into, I was happy to be there when somebody needed me. And when the effects of that stress or that trauma started to build up, oftentimes we don't even see it. And I don't think you can prepare for it. Like, it's not a normal exposure to stressors.
You gonna help me?
People are very frustrated and very upset, and oftentimes they take it out on the nearest person. Physicians often feel psychologically and physically unsafe.
Long waits for care are only ratcheting up the tension. Nearly all of Canada's doctors are self-employed contractors without workplace protections and benefits or paid time off.
We are aware of several physician suicides in BC in the last 12 months.
At any given time, 1 in 20 BC doctors has an open file with the Confidential Support Program, a number that grows annually despite a sense of shame and even professional consequences.
Every physician probably has a story of someone they know who was penalized in some way for seeking health care for mental health, for being honest and courageously seeking help.
And Penny joins us. Penny, these are some pretty upsetting details about the people we turn to in our time of need. So has there been any headway in getting more supports for healthcare workers?
You know, mi-jung, there is a widespread consensus that the stigma is fading and there are more supports and dialogue than ever before. But even after a major traumatic event, it can take weeks or even months for someone to see a therapist. So they're pleading for faster access. Caring for our caregivers isn't just the right thing to do. It impacts their families and the public, because we all benefit when they're able to be healthy on the job helping us.
Absolutely. Okay, thank you, Penny.
You bet.